Most people turn 65, enroll in Medicare, and think they're covered. Then they get a bill for $20, $30, sometimes $50,000 for something Medicare was never going to pay. Not because of fraud, not because of a mistake, because of 6 things Medicare never bothered to explain. I'm going to tell you all 6 right now. You are about to learn things that Medicare will never put in a brochure. Things they assume you already know. Things buried in government documents that nobody reads, and things that are costing seniors hundreds, sometimes thousands of dollars every single year. Not because of fraud, not because of bad luck, but simply because the system never bothered to explain how it actually works after you turn 65. This is not a scare video. This is the video someone should have handed you on your 65th birthday. Stay with me. The first thing Medicare does not tell you is that original Medicare was never designed to be enough on its own. Most people enroll in Medicare at 65 and feel a sense of relief. They are covered, they made it. But what Medicare does not tell you clearly anywhere in the enrollment materials is that original Medicare only covers about 80% of your outpatient medical costs. The other 20% is on you. Every doctor visit, every lab test, every imaging scan, every outpatient procedure, you owe 20%. And there is no cap. There is no annual out-of-pocket maximum under original Medicare alone. If something serious happens, a cancer diagnosis, a cardiac event, a prolonged illness requiring specialist care over months, your 20% share can keep climbing with no ceiling above it. This is not a gap in coverage most people know they have. And it is one of the main reasons this channel exists. On top of that, original Medicare does not cover dental care, it does not cover vision care, it does not cover hearing aids. These are not optional extras for most seniors. These are routine, predictable expenses that affect quality of life directly. And Medicare acts as if they simply do not exist. The second thing Medicare does not tell you is that there is a government program that pays your drug costs for free. And most of the people who qualify have no idea it exists. It is called Extra Help, also known as the Low-Income Subsidy. It is a federal program that helps people with limited income pay for their Medicare Part D costs, the monthly premium, the deductible, and the copays at the pharmacy. All of it at little to no cost. In 2026, a single person earning below approximately $22,000 a year may qualify. A married couple below approximately $30,000 may qualify. A significant number of seniors fall within these limits and have never applied because nobody told them this program existed. If you qualify and you are not enrolled, you are paying for prescriptions every month that the government would pay for you. That can add up to hundreds of dollars a year. Apply through Social Security at ssa.gov or ask your State Health Insurance Assistance Program, SHIP, for help with the application at no cost. The third thing Medicare does not tell you is that it pays almost nothing if you get sick outside the United States. This surprises people every time. Original Medicare has virtually no coverage outside the 50 states. If you are in Canada, Europe, or on a cruise ship in international waters and you need emergency care, you pay for it yourself. The bills come directly to you. Medicare will not pay them. For seniors who travel internationally, spend time abroad visiting family, or take cruises, this gap can turn a medical emergency into a financial catastrophe. A hospital stay in another country without additional coverage can cost tens of thousands of dollars. Some Medigap plans, including Plan G, include a foreign travel emergency benefit that covers up to 80% of emergency care abroad after a deductible. But Medicare itself never mentions this limitation during enrollment, and most people find out only after something goes wrong far from home. The fourth thing Medicare does not tell you is the difference between skilled nursing care and custodial care, and why that difference could cost your family everything. Most people believe Medicare pays for nursing home care. This belief is responsible for some of the most painful financial surprises in retirement. The truth is far more limited. Medicare covers skilled nursing facility care only after a qualifying hospital stay of at least 3 days, only when the care requires a licensed nurse or therapist, and only for a limited time, fully for the first 20 days, with daily coinsurance from day 21 to day 100, and nothing at all after day 100. Custodial care is completely different. Custodial care is help with daily activities, bathing, dressing, eating, moving around. It is the care that most people actually need long-term in a nursing home or assisted living facility. Medicare does not cover it, not $1, not one day. The average cost of a nursing home private room in the United States runs over $100,000 per year in many states. Medicare pays none of that if the need is custodial. This is the gap that quietly wipes out decades of retirement savings. This is the bill that arrives when a family is already dealing with everything else, and it is almost never explained during Medicare enrollment. The fifth thing Medicare does not tell you is that programs exist to help pay your Medicare premiums, and most seniors who qualify never apply. These are called Medicare Savings Programs. They are state-administered programs funded jointly by the state and federal government. Depending on your income and resources, they can pay your Part B premium, your Part A premium if applicable, your deductibles, and your coinsurance. Some programs even provide automatic enrollment in extra help for your prescription drug costs. In 2026, a single person earning up to approximately $1,500 per month may qualify for at least some level of assistance. A married couple may qualify at higher combined income levels that vary by state. Most people who could benefit from these programs never apply because they do not see themselves as someone who needs government assistance. But needing help paying a monthly premium is not a matter of identity. It is a matter of arithmetic. You can find out if you qualify through Medicare.gov or your state Medicaid office. It costs nothing to check. The sixth thing Medicare does not tell you is that you have the legal right to appeal almost every denial, and most people never use it. If Medicare or your Medicare Advantage plan denies coverage for a service, a medication, or a procedure, you have 60 days to file a formal appeal. This is not a courtesy. It is a legal right built into the Medicare program, and appeals succeed more often than most people expect. Studies show that a significant percentage of Medicare Advantage prior authorization denials are overturned when challenged. Most seniors who receive a denial letter assume the decision is final. They pay out of pocket or go without the care their doctor recommended. They do not know that an independent review entity, completely separate from the original decision-maker, will look at their case. They do not know their doctor can submit supporting documentation that changes the outcome. If you or someone you love receives a Medicare denial, the first question to ask is not how to pay for it. It is how to appeal it. The answer is often on that same denial letter, and the deadline starts the day you receive it. If any of these 6 things surprised you, if something I said changed the way you think about your own coverage, you are in exactly the right place. This channel exists to give you the information Medicare does not. Before you need it. Before a window closes. Before a bill arrives that you were not expecting and cannot explain. Every video on this channel covers a specific piece of the Medicare system in plain language. No jargon, no sales pitch, just the information that protects your health and your retirement savings. If this video helped you, like it right now. It takes 1 second, and it helps other seniors find this information when they need it most. Subscribe to the channel so you do not miss a single video, because each one covers something different, and the piece that matters most to your specific situation might be the very next one. And drop a comment below. Tell me which of these 6 things surprised you the most. Or leave your Medicare question. I read every comment and I respond to as many as I can. Your question could become the next video on this channel. The next video covers Medicare scams targeting seniors right now in 2026. Sophisticated operations using Medicare as the entry point to steal your identity and your money. If you or someone you love has ever answered a phone call about Medicare benefits, that video is essential. Do not miss it.